Hi, my name is Kristen Ramirez. I'm a student here at Franklin University. If you see me occasionally look down, I'm just looking at some notes. Today I'm going to be talking about a medication called clozapine, also known by the brand name called Clozaril. We're going to be talking about why someone may take this medication, how it works in the body, possible side effects, and some important things to know. So clozapine is a medication called an antipsychotic. It's mainly used to treat schizophrenia when other medications haven't worked well enough. It can help with symptoms such as seeing or hearing things that are not there, having thoughts or beliefs that aren't based in reality, or having trouble organizing your thoughts. Clozapine can also help lower the risk of suicidal behavior in some people with schizophrenia or schizoaffective disorder. Let's talk about what clozapine does once it's inside of your body. Your brain uses chemical messengers called neurotransmitters to help the brain cells communicate. These two chemicals, two of them in there, are called dopamine and serotonin. Clozapine changes how dopamine and serotonin work in the brain by blocking some of the places where these chemicals attach to brain cells. This can help improve thinking, mood, and behavior, and decrease symptoms such as hallucinations. Clozapine is not a cure for schizophrenia, but it can help control symptoms and improve everyday functioning. Now let's talk about how your body handles clozapine. After you swallow clozapine, it's absorbed through your digestive system and enters your bloodstream. Your blood then carries the medication throughout your body. Your liver breaks down or metabolizes most of the medication. After your body processes clozapine, most of it leaves through your urine and your stool. That is one important reason to take clozapine exactly as prescribed. Don't suddenly stop it unless your healthcare provider tells you to do so. Now, like all medications, clozapine can cause side effects. Some common side effects include feeling very sleepy, increased saliva or drooling, a fast heartbeat, weight gain, and constipation. Because clozapine can make you feel sleepy or faint, be careful when driving or doing activities that require you to be alert until you know how the medication affects you. Stand up slowly from a better chair because clozapine can sometimes lower your blood pressure and make you feel faint. Constipation is especially important with clozapine. In rare cases, clozapine can slow the intestines. Tell your healthcare provider if you're having any trouble with any type of stool, especially if you have stomach pain, swelling, nausea, or vomiting. One of the most important things to know about clozapine is it can sometimes cause a serious decrease in your white blood cells called neutrophils. These cells help your body fight off infections. Your healthcare provider will order a blood test called an absolute neutrophil count before and during treatment. If you develop a fever, chills, sore throat, or any other signs of infection, contact your healthcare provider right away. Clozapine can also rarely cause other serious problems such as seizures, inflammation of the heart. So if you have any type of chest pain, trouble breathing, severe weakness, or faster pounding heartbeat, let your healthcare provider know right away. Once again, these are very rare side effects of the medication. Clozapine is generally not approved for routine treatment of schizophrenia in children. So if it is used in younger patients, it requires very careful evaluation and monitoring by a specialist. Older adults may be more sensitive to side effects such as feeling sleepy, low blood pressure, falls, and constipation. There's also an important warning for older adults that have dementia-related psychosis. Antipsychotic medications, including clozapine, can increase the risk of death in these patients. Clozapine is not approved to treat dementia-related psychosis. So before we finish, here are the most important things to remember about clozapine. Take your medication exactly as prescribed and keep all of your appointments for your lab and your blood tests. Do not stop taking it suddenly unless your provider tells you to do so. Tell your healthcare provider if you develop any signs or symptoms of a fever, infection, constipation, chest pain, fainting, or seizures. Also, tell your healthcare provider about any type of medications you're taking, as well as your vitamins, supplements, alcohol use, because some of these can affect how clozapine works in your body. Clozapine does require extra monitoring, but for people who have not improved enough with other medications, it can be a very helpful treatment. If you have any other questions or comments about clozapine, talk with your healthcare provider or pharmacist. We're all here to help you to make sure that this medication is as safe as possible for you and that it helps you. Thank you for listening. Bye.